Hello. You must be the next Vault 101 resident. Are you ready to take the Generalized Occupational Aptitude Test? Wonderful. It is there to determine job placement. Every Vault resident is required to take the test. Afterwards, I will do a quick medical check just to make sure you are fit and healthy also. If you have any questions, don't hesitate to ask me, and if you would like to take a break at any time, just let me know. There are a total of 10 questions overall to determine which position you are best suited for. So, we shall begin. Question 1. You are approached by a frenzied Vault scientist who yells, "I'm going to put my quantum harmonizer in your photonics resonation chamber." What's your response? 1. But doctor, wouldn't that cause a parabolic destabilization of the fission singularity? Number 2. Yeah? Up yours too, buddy. Number 3. Say nothing, grab a nearby pipe and hit the scientist in the head to knock him out. For all you knew, he was planning to blow up the vault. Number 4. Say nothing, but slip away before the scientist can continue his rant. So, what will it be? Okay. Question number 2. While working as an intern in the clinic, a patient with a strange infection on his foot stumbles through the door. The infection is spreading at an alarming rate, but the doctor has stepped out for a while. What do you do? Number 1. Amputate the foot before the infection spreads. Number 2. Scream for help. Number 3. Medicate the infected area to the best of your abilities. Number 4. Restrain the patient and merely observe as the infection spreads. It's okay. You can take your time. Which one do you think you'll go with? Are you sure? Okay. Noted. Question number 3. You discover a young boy lost in the lower levels of the vault. He's hungry and frightened, but also appears to be in possession of stolen property. Do you? 1. Give the boy a hug and tell him everything's going to be okay. Number 2. Confiscate the property by force and leave him there as punishment. Number 3. Pick the boy's pockets to take the stolen property for yourself and leave the boy to his fate. Number 4. Lead the boy to safety, then turn him over to the overseer. I know some of the questions can appear quite strange. Are you sure? You want to change your mind? Okay. Okay. Next question. Congratulations, you made one of the Vault 101 baseball teams. Which position do you prefer? 1. Pitcher. 2. Catcher. 3. Designated hitter. 4. None. You wish the Vault had a soccer team. Okay. Excellent. Number 5. Your grandmother invites you to tea, but you're surprised when she gives you a pistol and orders you to kill another Vault resident. What do you do? Number 1. Obey your elder and kill the Vault resident with the pistol. Number 2. Offer your most prized possession for the resident's life. Number 3. Ask your granny for a minigun instead. After all, you don't want to miss. Number 4. Throw your tea in granny's face. Yes, rather an odd one. So, what will it be? Quite a tough one. I will give you some time if you want to think it over. Are you ready? So, which one? Interesting. Okay. Question number 6. Old Mr. Abernathy has locked himself in his quarters again, and you've been ordered to get him out. How do you proceed? Number 1. Use a bobby pin to pick the lock on the door. Number 2. Trade a vault hoodlum for his cherry bomb and blow open the lock. Number 3. Go to the armory, retrieve a laser pistol and blow the lock off. Number 4. Walk away and let the old coot rot. There are no right or wrong answers. Is that the one you wish to choose? Okay, that's what you're going with. Excellent. You're doing well so far. We're getting through these quite swiftly. Question 7. Oh no, you've been exposed to radiation, and a mutated hand has grown out of your stomach. What's the best course of treatment? Number 1. A bullet to the brain. Number 2. Large doses of anti-mutagen agent. Number 3. Prayer. Maybe God will spare you in exchange for a life of pious devotion. Number 4. Removal of the mutated tissue with a precision laser. So, what will it be? Yes, I do have my own opinions, but this is your test to take, as I already have taken mine. I'm not going to share answers. What shall it be? Tough decision again. That's okay. I guess it will be quite important as it does determine your job. So, a bullet to the brain, large doses of anti-mutagen agent, prayer, maybe God will spare you in exchange for a life of pious devotion, or removal of the mutated tissue with a precision laser. Interesting. Quite different to what I would have assumed based on your previous answers, but that's what we're going with. Question number 8. A fellow Vault 101 resident is in possession of a Grognak the Barbarian comic book. Issue number 1. You want it. What's the best way to obtain it? Number 1. Trade the comic book for one of your own valuable possessions. Number 2. Steal the comic book at gunpoint. Number 3. Sneak into the resident's quarters and steal the comic book from his desk. Number 4. Slip some knockout drops into the resident's Nuka-Cola and take the comic book when he's unconscious. So, what will it be? Which number would you like me to repeat? Number 2. Steal the comic book at gunpoint. Okay. And that is what you have picked. Excellent. Question 9. You decide it would be fun to play a prank on your father. You enter his private restroom when no one is looking. And 1. Loosen some bolts on some pipes. When the sink is turned on, the room will flood. Number 2. Put a firecracker in the toilet. That's sure to cause some chaos. Number 3. Break into the locked medicine cabinet and replace his high blood pressure medication with sugar pills. Number 4. Manipulate the power wattage on his razor so he'll get an electric shock next time he shaves. Yes, well, neither are catastrophic, but they would prove quite annoying, I imagine. Are you going for the one with the most chaos or the one of most annoyance? That would be rather funny. Okay. You're doing excellent so far. Question 10. Who is undisputably the most important person in Vault 101? He whom shelters us from the harshness of the atomic wasteland, and to whom we owe everything we have, including our lives. Number 1. The Overseer. Number 2. The Overseer. Number 3. The Overseer. And number 4, you guessed it, the Overseer. Correct answer. That one there is not much choice. Okay, that wasn't too bad, was it? Now I will calculate your results. Let's see here. Yes, it doesn't take very long, does it? Considering it determines your job role for the rest of the duration in the vault. Do you have any questions before I get the results for you? Sadly, we have to take your first answers this time around. Yes, as I said, each vault resident must take the test. So we have all taken it here so far. Okay, are you ready to find out the result? Excellent. So, congratulations, tattoo artist. Well, I wonder who will be brave enough to be your first customer. Not me, that's for sure. Although, who knows, maybe you have quite the creative eye. So, now on to the medical exam. I just have a few more questions to start. So, number 1, had you been taking any medication prior to these questions? Okay. Do you have any known allergies? Well, yes, I suppose there are those that we wouldn't know of for sure, but any known allergies? Okay, that's a good start. Do you regularly exercise? That is very good. Excellent. From a scale of 1 to 10, how anxious would you say you are currently feeling? Yes, you can even go in between that. Okay. Do not worry. A lot of us suffer with anxiety from time to time. Some of us suffer with it longer than others. But we are all here for you and rather a great support, I have found myself. Yes, everyone is rather kind, even those who don't have any medical abilities or those who are not medically trained at all. Yes. Well, as I say, we are all a great support here, if ever you need us. So, how many hours of sleep do you get, usually? Yes. Based on your previous answer, I could have guessed that. But not to worry, again, it's very common, and a lot of us here are so busy that even if we would like more sleep, we can't really help it. Yeah, there is lots to do here, but that's okay. Would you say that you suffer from depression at all? Yes, I understand. Usually depression and anxiety go hand in hand. Sometimes it can linger longer than others, but we just have to push through. That's it. Some days are good days and some days there are bad days, but it is ever changing. There will be another good day around the corner. Many more around the corner. Okay. If you would like a discussion about that in more depth, please don't hesitate to ask me anytime. Have you any previous history with mental health issues? Would you say it was more recent? Okay. I understand. Any negative thoughts recently? Yes. It doesn't really matter to what scale, I think you all know. Okay. Yes. Again, that's to be expected, and it's not uncommon. It's a rather vague question, really. We all have negative thoughts from time to time, regardless of the scale. As I say, some days are more difficult than others. No problem. Okay, any signs of a cough or cold? Okay, that's fantastic. How about in the last month? Yes, I know it's rather hard to gauge a month, but as recently as you can think. Okay. And let's just check your weight. Could you please step onto the scales for me? Thank you. And if you could just give me the reading at the bottom there. Okay, that's healthy. Can you confirm to me what year it is? Sometimes even I struggle with that question, despite it being rather simple. But that's good. Do you have any of the following conditions? Heart disease? Not that you know of. Stroke? Diabetes? Asthma? High blood pressure? When was your last check? Okay, that's fine. Epilepsy? Okay, not that you know of. So far, so good. Okay, I'm now just going to check your visual responses and also your hearing and various other things. First, going to check your vision, as it tells us if there is anything going on neurologically. So, if you could just follow the torch for me. This might be a bit bright. Wonderful. If you could just simply follow my finger. Keep your head still though, and just follow with your eyes. Okay. Just do that again for me. I'm just going to check something. Follow, follow, follow. That's it. Keep staring. Okay, great. Now I'm just going to cover each eye at a time, and I'm just going to check the backs of your eyes. Okay, ready? And just stare straight ahead for me. Wonderful. You're doing really well. Okay, and now the other side. That's it. Keep staring for me. That's it. Great. Doesn't seem to be anything too untoward so far, so that's good news. Now I just want you to look up for me. Okay. That's great. And now could you please look down for me? Fantastic. Okay, that seems to be all good so far. I'm just going to make a few notes. Have you had any previous problems with your sight? Okay, that's good. Are you sensitive to temperature at all? Do your eyes water in hot or cold weather? I suppose it's rather consistent in the vault, but if you have any sensitivity at all, or prior to this even. Okay. That's great. I'm just going to finish with the eye exam, and then we will check your hearing. So, if you could stare at these General Occupational Aptitude Test pictures, and I'm going to check. So first, stare at this one for me. Keep staring. That's wonderful. Okay. And now look towards me. Okay. That's wonderful. Okay, now I want you to look at me and then look back at the pictures. Okay, and looking at me. And now look towards the pictures. Okay, that's fantastic. So, now I'm actually just going to check your glands. So, if you could tilt your head up for me. That's it. Slowly. I'm just going to check here. Okay. Yes. You see they're all connected, so it's rather important to check everything, just in case. Everything seems to be fine. So, there is no signs of swelling. If you could turn your head slightly for me, so I can check your ear. That's good. That's it. And now back towards me. Fantastic. Now I'm just going to check the other side. Turn slowly. Okay. And look back. There we go. Fantastic. Have you had any previous problems with your hearing before? Well, everything looks fine there. So what I'm going to do now is I'm going to put my hand over each of your ears in turn, and I'm going to snap my fingers 3 times. I just want you to tell me if it's relatively the same for both. So I'm going to cover this ear first, and okay, now I'm going to cover your other ear. So how is that? Relatively the same. Okay, that's good news. Hopefully that isn't anything too serious. So you're all looking perfectly healthy with your sight and your hearing. Okay. If you have any problems in the future, as I say, don't hesitate to contact myself or any of the other medical trained staff. Have you any questions for me? Well, I've been doing this for a fairly long time now, but time seems to escape me in the vault, so it's hard to say for sure. Yes, well, we do what we can. So, that's everything. Then I will bid you farewell and good luck with your new job. Take care.